month we're looking at the new frontier in surgery, and today's a really exciting interview because we're going to talk about how a robot is helping surgeons do some really amazing things. Dr. Rafael Perez is with me. He's a gynecologic surgeon, and what he's going to be talking about can actually be used for other surgeries as well. Good morning, thanks for joining us.
Good morning, Vanessa. Thanks for having me.
Now, I think a lot of people have heard about laparoscopic surgery and sort of the comparison to conventional surgery. How did laparoscopic surgery sort of move things along and improve things?
What happened at the end of the 1980s, we were looking for a way to do surgeries instead of using a big incision, which is what everybody was used to, with very small incisions. The instrumentation at the beginning wasn't there, but we slowly developed it, and it became a big deal in the sense that everybody wanted to have that surgery, which people call Band-Aid surgery, minimally invasive, multiple names. But what it allowed us to do was to do a big procedure, send the patient home either the same day or the next day with less pain than what it was before, shorter recovery period. So that's how it came along, probably around in the early 1990s. That's when it really began to take hold.
Okay, so things like quicker recovery, is the anesthetic that's used different as well, or does it depend?
No, it's the same type of anesthetic. There's some considerations in terms of the agents used, in terms of recovery from nausea and vomiting and things like that, but most of the time it's actually better. Some of the procedures are slightly longer, but that doesn't impinge in the overall recovery period of the patient, either from recovery room to go home that same day or the next day.
Which that alone is just a huge difference. Now, as we said, we're moving into a new frontier. There's something called, it's a robot called the Da Vinci, so it's still a laparoscopic type procedure, but now you're using something else to help you.
Correct. This is the new toy on the block, and laparoscopy has always been about the toys. But what the robot has enabled us to do is now take laparoscopic surgery, which is, you have to think that we're working with 5mm instruments, which are very tiny, and now we are trying to do very complicated surgeries. And what this has allowed us to do is that now we have a robot that actually helps us steady our hands, be able to do very difficult procedures that before were not able to be done laparoscopically, and be able to have the benefits of normal laparoscopic surgery for those patients who have more difficult surgeries.
Okay, what type of surgeries, for example?
Well, what we are doing a lot is hysterectomies and myomectomies. Myomectomies is the medical word for removing fibroids, which are a very common benign growth that can happen in the wall of the uterus. And these procedures in the past, especially if you had an extremely large uterus or you've had prior surgeries, were very difficult to do laparoscopic. Only a handful of surgeons in the country were able to do them. By adding the robot, we are now able to take those cases and offer more people the same benefits of the laparoscopy. And this is where it becomes a paradigm shift in how we're going to take surgery to the next level. And this is not only in gynecological surgery, we're talking cardiac, urology, cancer surgery. It is revolutionizing the whole field.
Now, you've told me there are some sort of wow factors associated with this. What are those?
Correct. The first time we got presented, the robot, by the way, was approved by the FDA in 2005. So this is a new technology, but very safe and well proven. Since then, it's been 4 years. Thousands of cases have been done, and the safety of it has been already proven. But the first time that we're normally as surgeons, we're always sat there at the bedside and operated everything. For the first time, we're sitting at a console a few feet away from the patient and manipulating all these instruments. At the beginning, you have this feeling of, oh my God, I'm not even touching the patient. But with the better visualization that the robot gives you, the better handling of the tissues, you're now operating safer. And this is what really, in my mind, said, I've been doing laparoscopy for a long time. This is the new frontier because it's making it much better and much more accessible.
And the precision is just unbelievable.
It's incredible. There's no wavering. Your hands are no longer holding the instruments. This is a robot. Similar to the auto industry when they talk about spot welding. I mean, you could have a master spot welder. They wouldn't be as good as the robots that do it now. Obviously, there's still the issue of training and the issue of who has the experience to do this. This is there's no guarantee that's just because the robot is done, the surgery is going to be better. You still need somebody, driving the plane.
And I suppose it's really going to depend on the patient and what they're, maybe not everybody is eligible for this surgery, or?
Correct. As we have had a lot of experience, and like I said, early 1990s, now we're talking about 20 years plus of laparoscopy experience. Medical factors do come into play, and they have to be individualized, but we are doing more and more patients that have multiple medical conditions, so that alone is not an exclusion criteria. Mm-hmm. There are some others, and obviously depending on what your ailment is, we have to decide whether you are an appropriate candidate. But in general, in practices that use the robot, you would say upwards of 90 to 95% of all surgeries are done laparoscopically, so that's pretty good.
That is really good news. We are out of time, but just where do you see the future of this going?
Oh, this is going to be, having a robot in your hospital means that now you have access to all the surgeries that you want to do, and at the same time be able to leave home either the same day or the next day and without less pain. It's just fantastic.
Yeah, I wouldn't want that. Okay, Dr. Perez, thank you so much for joining us.
Thank you for having me.